In all this, you can build on the lots of strengths that you have in Portugal. For example, during the EU presidency, I recall that you were doing a lot of pioneering work on social determinants of health, but also on migration and health, and that is something you can take into consideration. Then you have some very successful government policies on maternal and child health and early childhood development, which is closely linked also with the social determinants. And you have a huge research capacity in this country, a very strong research capacity, and you need to strengthen close relationship between the governmental level and the research community even further. You can also exploit European and global experience for the next phase of the National Health Plan. Then we need to further strengthen mechanisms for governance and coordination of intersectoral action. I already mentioned other ministries and especially the ministries of finance. One more issue to flag up is that it is always useful in intersectoral collaboration to use tools such as health impact assessment, and I would like also to put the weight of WHO behind the health impact assessment through the new health policy, because every time when a new legislation is being developed in another sector, if you are serious about the health in all policies approach, you should always take it through an impact assessment and particularly through a health impact assessment. That is a very useful way. I know in practice it is quite a challenge to implement it. Obviously, you have to involve all relevant stakeholders across the government, that we already said, but you also have to involve all the public health community as you do today, and involve the regional and local levels as you also do today. So I think from this perspective, the consensus building process is going very fine. One more issue that might be useful to consider is to make the link between the government and the parliament and to send at regular intervals a report on how the health status of the population is improving in Portugal at a regular interval, and keep the parliament informed on what is going on in this respect, and also the links to social determinants and health equity, so that this link can be made and the parliament through the political powers can also follow up and ensure accountability. So finally, let me just finalize with a few thoughts. So the success of a European health policy will be achieved when governments will take a collective responsibility for achieving health gains. It means that every minister should be a health minister in their sector. It is important to understand and recognize that health is not the only priority of governments, and therefore we have to work also with the other sectors to have an approach that fits with the other priorities. To achieve health gains in a sustainable way, we must be able to argue for health in an understandable way and position health clearly in the frame of other conflicting priorities. And we need to have the support of the population. We need to engage, inform through numerous channels. And in my view, one of the key challenges for health policy and public health in the years to come will be to build a new communication and information strategy which makes absolute and maximum use of the present high-quality technologies. And this H1N1 pandemic was a clear eye-opener that we are not there yet in our communication strategies in the public health area, and we have to make progress. And those who were the anti-vaccination groups, they were much better in the use of the communication technologies, and therefore they had better results than many of the countries did in the vaccination campaigns. This does not go for Portugal, because I was very impressed by the communication strategy that you put behind the H1N1, Madam Minister. So the health sector is exemplary of the interconnected policy making that is required for the 21st century, and it requires to build strong capacities and the momentum for integrating health in all policies. Health in all policies is demanding and requires an active approach from the Ministry of Health in different capacities. It requires new structures, new processes, and particularly if they have the legal basis, they are very useful. And one of the things that I think WHO will also have to do is to help the governments to put all these new structures and processes in place, not only to advocate for a health policy, but also to support, as we do in the case of Portugal. And finally, Madam Minister, High Commissioner, let me say that Portugal has many very positive assets and opportunities to make good progress on the health in all policies through the next National Health Plan. It also has an opportunity and a duty to pave the way for other countries in the European region with the experience that you have already developed during the last few years. And please rest assured that we will work with you hand in hand also for the next health plan and to further improve the health of the Portuguese citizens. Thank you very much.
Thank you, Zsuzsanna, for your excellent lecture and your support. And em nome da Sra. Ministra da Saúde, não é antes, em nome da Sra. Ministra da Saúde, declaro encerrada esta sessão. Muito obrigada.